Hello, good evening, everyone. I hope you're having a wonderful Wednesday evening. My name is Corrine Baker. I am the founder and the fertility coach for Hope Fertility Support and Wellness Center. So thank you for joining me this evening for our weekly support group and information session, just to kind of educate you and get you familiar with the process of trying to conceive, or any challenges that you may be having and what to do next. So that's why I started the weekly Hope for Babies support group. And it's pretty much 30 minutes with me. You get to ask your questions, get them answered, and I will share with you tips and answer your questions. So during this time, you can always message me. You can comment below, you can email me, and all of that information is in the support group. So you can always go there, and you can email me at info@hopefsc.org. Again, that's info@hopefsc, like Frank, Susie, Charlie.org, and send me your questions. I received several questions since our last meeting, our last support group last week, from all over the world, from Guyana, Jamaica, Curacao, England. So I was very surprised that there's quite a few women out there that are dealing with the same things, that's looking for answers. And so it was very good to hear from them, and I'll answer some of their questions here as well, because you may be dealing with the same issues that they have, and someone else may be dealing with the same concerns that they have. So it's always good to share that information here. Also, you can let others know about this. If you know someone who's struggling with infertility, let them know that we're here to support them. This is not an official support group where we meet and we spend an hour and a half, 2 hours where we talk and share in person. This is more of an information support. So if you have questions, this is where you can come to get answers. So please share that with anyone else who you know who may be on a fertility journey and having a hard time, because you just never know who you can help. Not everyone discusses what's going on with them when they're trying to conceive, especially if they're having a hard time. Because for a lot of people, it's embarrassing. It's hard to discuss that with other people who they feel may not understand them. And so they don't want to really share that with anyone. So this is a place where you can share that, because everyone in this group is experiencing some type of fertility challenge. I shared with you last week, I myself have experienced fertility challenges. I have gone through 2 rounds of IVF before I was finally able to get eggs and have them, sperm and everything. And now I have embryos, and which are stored. But it took a while to get to that point, and it was not an easy journey. And I took part in a lot of your holistic alternative medicine options. I did not want to just use a lot of fertility drugs. I'm not one to take a lot of pills, and I don't like injections. So I utilized a lot of holistic options before I had to resort to doing IVF. And so I just want you to know that there are alternative options out there for you. And so tonight, I'm going to discuss with you when is a good time for you to seek help with a fertility doctor, and also with an alternative medicine practitioner. And an alternative medicine practitioner is someone who does acupuncture or massage therapy. Those are alternative medicine practitioners. So I want to share with you some of the reasons why you would seek out going to a doctor first. And we strongly recommend that, because especially when you're dealing with fertility, we will not work with anyone who has not seen their fertility doctor first, whether it's your OBGYN or reproductive endocrinologist. We value and respect the medical community. We want to know what is going on with you first. because I have had many women that have come to us or call us, email, and they said, I can't get pregnant. And when we ask them, well, what did your doctor say? What's the reason why? I don't know. Well, we need to know, because we need to know what's going on so that we can effectively treat you so that you can see results. If we're treating you blindly and not knowing exactly what's causing your reproductive challenges, it's unfair to you. And I am someone who, I don't like to waste my money, and so I don't want to ever do that to someone else. I'm not here to take anyone's money. I'm here to help. And in order to do that, I feel it's so important to be fair, honest, and upright with people so that they don't waste their money and doing things that are not going to help them and benefit them in any way. So I always said when I started this practice was assess the medical first. As a social worker, I'm trained to do that, and that's my background is in social work, and we're always trained to assess the medical first. You just don't treat people without knowing what's going on. So I strongly recommend, and like I said, I will not treat, or we will not treat anyone without assessing the medical first, especially when it comes to fertility. So one of the things is, how do you know when it's time to seek out the OBGYN or reproductive endocrinologist, fertility doctor? How do you know when it's time? So a rule of thumb is this. If you're under the age of 35 and you have been trying for at least a year and nothing is happening, and you know that you feel that, you know, I'm healthy, I don't have any medical conditions that will interfere with me getting pregnant. My partner, I know he's okay. He has he has sperm count, or maybe you've had children before, but it's not happening. It's been a year of trying and nothing is happening. Or if you're over the age of 35 and you've been trying for 6 months and nothing is happening, at that point, you need to see the fertility doctor, the OBGYN. That is a time when you need to go in and you need to get a full workup done. You need to be prepared that when you go to the fertility doctor, your OBGYN, in regards to fertility, be prepared when you go. Do your homework. Don't just pick someone that is the nearest fertility clinic to you and you have no idea who they are. Do some research on them. Look them up on the internet. See what other people are saying about their experience with that doctor. Because I'm here to tell you, as someone who's gone through this process, it is so, so important to have a doctor who will stand by you, who will be patient with you, who would listen to you, who would show compassion to you, because there's nothing worse than you've been trying to conceive. You go to the fertility doctor, and the only thing they tell you is, well, you have no eggs, or there's nothing we can do, and they leave you. I've had an experience like that. I know what that's like. And I switched doctors. I have a great doctor now who I've worked with, and she is outstanding. And she is one of the doctors who I recommend. All my referrals go to her. Because when I tell you, she has patience and she will fight for you, and she will do everything. She will use every tool in her toolbox to help you. That is the kind of doctor that you need on your side. So if you go to the doctor for the first time and you're having your first visit, be prepared. Go in with your notebook. Let them know this has been my history. Whether you've had children before, at what age, were there any difficulties, did anything happen, were there any type of STDs that have happened that may have caused you now to have challenges? Were there any, whether it's uterine fibroids, surgeries, anything? Be upfront with them so that they can know how best to tailor a treatment plan for you. Also, when you're doing that, be prepared to hear things that you are not wanting to hear. Because when you go in and you meet with a doctor and they said, okay, well, let's do a vaginal ultrasound. They may look and say, well, we don't see a lot of follicles. And so we don't know, but we can try to stimulate going through drugs, and we can see what happens there. But or they can tell you we don't see any follicles at all. Do not become paranoid to that. All you're supposed to do at that point is get the information, let them do the blood work, see what comes back, and at that point, give us a call. We can take it from there and help you from there if it's something that is not surgical. We don't perform surgeries at Hope Fertility Support and Wellness Center. We treat conditions naturally. So if it requires surgery, such as I get a lot of my tubes are tied, and so now I want to have kids. Well, we can't help you with untying your tubes because that's a surgical procedure. Now we can refer you to a doctor in the area, but we ourselves cannot do that because we don't perform surgery. However, after you had the surgery, we can help you with reducing scar tissue buildup. Because if scar tissue forms again, that can be a blockage that could prevent you from conceiving. So once you go to that fertility doctor, your OBGYN, they do the workup, they give you the lab results, they share with you the ultrasound findings. That is when you can contact us. And from there, you will bring to us all of your medical documents so that our doctor, Dr. Tynes, she can then review it. You will set up a consultation, whether it's over the phone or face-to-face over the computer or face-to-face in the office. Right now, we're not doing any face-to-face in the office because of course, the COVID-19. So all of our consultations will be done via the computer. So you can do face-to-face over the computer on Zoom. We also have another site that we use for that. But it's face-to-face. She will review all of the assessments that we've given you to fill out. She'll review all of your medical documents. She will then tell you what can be done, what you need to do next, and how long it's going to take for you to see some desired results. Whenever you're dealing with holistic, remember, is natural. So holistic takes a little bit more time than if you were to do something that is like fertility drugs. So holistic is done with herbs, acupuncture, or you can meet with our doctor face-to-face now during this COVID, and you can actually have treatments with her over the computer where she will tell you what to do while you're on the computer with her, and we use acupressure points. There's also Moxa take-home kits that you can use, and she'll tell you how to use that. Follow up with you with your nutrition, tell you exactly step by step what to do next during each session. So you're pretty much doing your own self-treatments at home over the computer with her while she's observing you to ensure that you're doing it correctly. Since this is a time of social distancing and unfortunately we cannot interact with one another right now face to face. But it does not mean that we stop all fertility treatments. No, they're still continuing. Like I said, the doctor is still seeing patients via the computer. So we treat people from all over the world. It's not like it's limited just to the Central Florida area. People, like I said, from all over the world contact us. They want treatments, and we help them from all around the world. And we've been successful. One of our patients came from as far as Turkey, and within 3 months, she was pregnant. And she went to the fertility clinic, got the workup. It was an unexplained infertility. She did 3 months worth of treatments with Dr. Tynes. After her first month of treatments, because she had irregular menstrual cycle, after the first month of treatments, she had a cycle that came on after 28 days. The second month, same thing. The third month, there was no menstrual cycle. And when we tested her, she was pregnant. So, like I said, natural medicine is very effective. It can help to support the body, nourish the body naturally. So where you have deficiencies that are making it difficult to conceive, natural medicines act as like a tonic, and it helps to build those deficiencies versus utilizing various drugs to kind of alter the body to perform in a certain way. But then when it's all said and done, those deficiencies are still there. Whereas natural medicine acts to heal the body. So that's the goal, is to heal the body from within, so that it can support you and allow you to be able to conceive naturally, or if you have to go through the IVF process, the goal is to reduce the number of times that you have to go through an IVF process. So our goal in working with you would be to help to tone the uterus, increase blood circulation to the uterus, help to support the hormones, to balance the hormones. Because a lot of you are writing to us and saying, I have PCOS, endometriosis, uterine fibroids, my FSH is high to the point where they're saying I'm in menopause, and you're young, you're still in your 30s. So all of these things are hormonal imbalances, which we utilize herbs as well as acupuncture or acupressure treatments during this time, nutrition, to help to balance the hormones, and so that you can conceive naturally. So that is something that I wanted to let you know, that although yes, we refer to your medical doctor and we will want that workup first, we can assist you holistically if you are willing to do the work. And if you are willing to devote at least 3 to 4 months to correcting the deficiencies in your body naturally, then this is something that you may want to explore. It is a lot more cost effective than your traditional IVF treatments, especially if you cannot afford to go through IVF treatments. And we support whatever option that you choose, whether you choose to do IVF, you choose to use natural as well, or both. We support your decision and will help you in whatever decision you make and support that. However, it is a lot more cost effective, but it does require you to have discipline and be willing to do the work naturally to help to restore, balance, repair the deficiencies in your body that can help you to conceive naturally. So I just wanted to let you know about that. And like I said, when you go to that doctor, be prepared. Take your notebook, ask questions. If you forget something, write it down so that you can ask our doctor, or you can, when you go back for your follow-up, you can ask them then, or call the nurse line and talk with someone. So you want to be able to get those answers. Also, if you would like for me to go with you, if you're in the Central Florida area, you can hire me as your fertility advocate, and I will go with you. I will ask those questions that you may not even be thinking of, and I'll be that support for you during your appointments. So I am available for that as well. Dr. Tynes right now is running, we have a specialist going to meet with her. So if you want to meet with her for a consultation and 4 sessions via the computer, like a Zoom, the special is $299. That's normally over a $600 $650 worth of sessions and a consultation that is currently $299, because you'll be doing the work yourself, not her, but she will be with you. They're 30-minute sessions and consultation, and she will be with you, watching you, monitoring you, telling you what to do exactly. She would modify your treatments, your herbs, tell you what supplements to take. So each week she'll be checking in to make sure to see how those herbs are interacting with you. How are you doing? Do they need to be adjusted? Anything needs to be increased or added or taken away? So she'll be monitoring you closely. And you can always go on our website, www.hopefsc, like Frank, Susie, Charlie, www.hopefsc.org. And you can go to our services page and you can book the consultation with her, which will include a consultation and 4 virtual sessions with the doctor face-to-face for $299. So that's like a rare find. That's a steal. A consultation with Dr. Tynes by herself is $250 for an hour session. So you'll get a half an hour session with her. She'll review all your assessments, your medical reports, and then you'll get on the computer with her. And at that time, she'll tell you her findings. You can ask questions for those 30 minutes. And then you also will have a session, a treatment session right after that. And then you'll have 3 other sessions for the next 3 weeks with her. So that is an option for you. So just to recap, when to seek, like I said, the fertility doctor versus the alternative medicine practitioner. Like I said, assess the medical first. Not every alternative medicine practitioner or wellness center, such as ourselves, will require that. Some places you can walk into and they will just ask you what's wrong. You said, I can't have kids, and they'll treat you. But how do you know that what they're treating you for is correct to what the doctor is saying is wrong with you? It's a guessing game at that point. And I don't play guessing games when it comes to people's health. I need to know exactly what's going on so that we can tailor it specifically to what the problem is. Now, we also will explore other options when you bring the medical records and we say, well, this wasn't explored, let's look at this, or we'll send you for this additional testing. But at least it gives us a baseline on where to start. And that's so important. So be careful on who you go to for alternative medicine treatments when it comes specifically to fertility. Not everyone specializes in that area. I am a part of the American Reproductive Society of Medicine, and that is important. Not everyone has that credential there, but it is important for us because that is something that all of our practitioners specialize in, the treatment of reproductive medicine, female issues, health issues, and also male. There are men who have challenges. It's not always the women. And their challenges could be low sperm count or no sperm. And we also help them as well. So some of our services that we offer that can be of great help to you is acupuncture, herbs, supplements, massage therapy, nutrition, mental health counseling, support groups, fertility coaching, which is what I do as well. That's what I do, as well as support groups. So our team has over 60 years of experience doing this work. We're not new to it. And so I encourage you that whoever you choose to work with, wherever you are, make sure that they are experienced and trained to work in reproductive health. And so that you can get the benefits of the treatments and not waste your time or money, because that's valuable, especially if you're trying to start a family. So before I go, I'm going to answer, there was a couple questions, and then I'll give you a couple tips and we'll end there until the following week. So once again, I received a lot of questions from last week to even today. Several questions came in today from all over the world. I got from Jamaica, Curacao, England, Guyana, here in Florida. So I was happy to see that, because it just shows we're not the only ones. There's women all over the world who's experiencing the same challenges. So one of the questions that I had frequently asked today was about miscarriages. And I shared last week, that's a very challenging, very difficult thing for any woman to have to experience. And so what I would suggest in a situation like this, if you're having frequent miscarriages, seek the doctor and find out why. You want to know why. That's important. Why is this happening? Is it chromosomes? Is it a genetic thing? Is it because your uterine lining is too thin so it can't carry a child to term? What is it? You want to know what that is. And then, yes, we can help to support you with that and help to reduce the miscarriages from happening through herbs. We do have herbal treatments that we can utilize, which we've done for other women, and they've been able to carry the child to term. So there are things that we can do. All you have to do is schedule a consultation with Dr. Tynes, and then she'll be able to, like I said, review your medical findings and then prescribe whatever herbs is necessary to help you, especially in that first trimester, so that you can support your uterine lining, make sure that it's thick enough to support carrying that child to term. Another question that I had a lot of today was on PCOS, Polycystic Ovarian Syndrome, and wanting to know, how do I know when I'm ovulating? My doctor gave me Clomid, but nothing has changed. So how do I know if this is working? What do I do? Okay, PCOS, Polycystic Ovarian Syndrome. It's definitely a hormonal imbalance. And so oftentimes you don't know when you're ovulating. Sometimes you don't even get a cycle. And so you may get put on like Clomid, and Clomid may or may not work for you. So sometimes you just don't know if you're ovulating or not until the underlying issue is resolved with the hormonal imbalance. You may or may not know when you're ovulating, because sometimes you don't even get a cycle. And so we would treat the underlying root cause of what is happening to you and balance out those hormones with acupuncture, herbs, nutrition, and to help to balance them out. And so that you can start to have a regular cycle, reduce the symptoms of the PCOS, and help you along the journey so that hopefully you can start ovulating by yourself. Or if you have to take Clomid, that it will work, because your body will be more in a prime state to be able to then allow the medication to work and ovulate. So recommendation again for the PCOS, talk with your doctor, find out what's going on, see us, and then we can help you naturally with that process of improving the hormonal imbalance. So 2 tips that I want to leave you with for anyone that's on a fertility journey. If you're on that fertility journey, please drink lots of water. A lot of you are a lot of coffee drinkers, soda drinkers. You have to remember that if you're trying to prepare for a child, you have to give a child fertile ground to grow in. Coffee does not support fertility, especially if you're having challenges. It has no benefits to you at that point. Okay, so you want to give your body the most optimal state to function in, and water is needed, not the occasional 1 glass every now and then. You need to be drinking at least 64 ounces of water, and some people need more because they're more active. So it's going to the amount of water you drink is going to depend on how active you are, your weight, any health conditions. So discuss that with your doctor to get the proper amount but you need to be drinking water. Your blood needs to be circulating. Your organs need to be circulating. Your cells need to be hydrated. You cannot expect your body to fight for you if it's dehydrated. So drink water daily. That's so important. Also, another thing is vitamin D. Most people are vitamin D deficient. I myself struggle with that and take a supplement daily just to maintain a proper diet, a proper vitamin D level. Please have that checked by your doctor. Some doctors don't test for it unless you ask. Let that be a part of your routine and your physical. Ask them, can you check my vitamin D when you do my blood work? And make sure that it's done. I can guarantee most people are vitamin D deficient, and vitamin D is linked to infertility. So get that checked. And then ask them, how many IUs do you need to take to get into the normal range? And take your supplements daily. For some women that we work with, once we tested for various vitamins and nutrient deficiencies, they automatically got pregnant on their own once we got their levels into a normal range. So those are two things that I'm going to leave you with today. Consider yourself, when you're trying to get pregnant, get into the mindset of thinking of, I'm already pregnant. How do you nourish your body, your mind, because now you're pregnant? If you have a mindset of being pregnant, you're going to care for that unborn child with everything that you have. And so you want to support the development of that child. So two things is, start by drinking lots of water every day, not once a week. Some of you say, I don't like water. Get used to it. There's things you got to do when you're pregnant that you just don't want to do, you don't like, but you have to do it to support the development of your unborn child. So get used to it. If you need to add fruit to your water to give it a little flavor, raspberry, strawberry, squeeze a little lemon in there or lime just to give it a little flavor, do it. But you must remain hydrated. The blood has to be circulating. And then, like I said, vitamin D. I can guarantee you most people are deficient, so get that checked. Get on a supplement to increase that number so they can get into the normal range. And from there, you can always reassess to see what else may need to be improved. And so you can always, once again, give us a call. Our office number is 321-203-2213. You can always email us, info@hopefsc.org. Visit our website, www.hopefsc.org. Share it with other people. Like I say, you just never know who's struggling, who's had a miscarriage, who is fighting depression or postpartum depression. They just had a baby, or a couple that's really struggling with failed IVF cycles or miscarriages, or you just never know. So just share our also our Facebook page, Hope Fertility Support and Wellness Center. Share that with others so that we can be of help to someone else. So I hope this has been a great help to you. If you have any questions, email me and I will try to get to all of your questions next week. Have a great night. Bye-bye.